Here will be discussed tomorrow. Okay, just a minute. Okay. So let's start. Now, first tell me what is the blood supply of nose? Anyone who can give a try? Okay, just to make you comfortable. Nose blood supply. You get confused between nose blood supply and Little's area or Kisselblack's plexus. Nose blood supply has how many arteries? These are five arteries. Okay, five arteries. First one is spinopalatine artery. Second one, greater palatine artery. Okay, third one, superior labial artery. Fourth and fifth, anterior ethmoidal artery. Fifth one is posterior ethmoidal artery. How you can remember? You can remember by the mnemonic gas P. That is the blood supply of the nose. Okay. Now, anatomy question. Spinopalatine artery and greater palatine artery is the branch of which artery? Anyone? That is maxillary artery. Okay. Maxillary artery is a branch of which artery? What do you think? It is the branch of external carotid artery. Superior artery is the branch of, what do you think? That is facial artery. But sometimes you will not get facial artery as an option. Even maxillary artery as an option for spinopalatine artery and greater palatine artery. Okay, they will directly give you this. Okay, they will skip the middle artery part. They will ask you the main artery directly. Okay, anterior ethmoidal artery and posterior ethmoidal artery is the branch of which artery? Of the ENT anatomy. You should know it by now. What do you think? This is called as ophthalmic artery. And ophthalmic artery is a branch of which carotid artery? That is internal carotid artery. Okay. Now, Kisselblack's plexus or Little's area do not contain which artery from nose blood supply? Or how many arteries are present in Kisselblack's plexus or Little's area? Remember, not a branch of Kisselblack's plexus. Okay, so which arteries are the part of Kisselblack's plexus? That is gas. I will write down over here so you can remember. Gas. Okay, greater palatine, anterior ethmoidal, superior palatine, और कौन सी बच्ची है? Spinopalatine artery are the branches of Kisselblack's plexus. You can remember by the mnemonic gas. Now tell me, which is the most common site for nasal epistaxis? that is Little's area, right? Most common artery, that is spinopalatine artery. Spinopalatine artery is the branch. Most common cause, and most common cause in children, that is nose picking. Nose picking, right? Children used to put their fingers in the nose. That is the most common cause. Okay. Most common cause in adult. Anyone? Most common cause in adult is not nose picking, that is hypertension. Okay, hypertension. And third is most common cause in juvenile age. Juvenile age is how much? From what to what? Remember, whenever you are getting question from 10 to 20 years, 10 to 20 years of age, the most common cause of nasal epistaxis is always going to stay as angiofibroma. These are three different questions. Whenever you are getting question on nasal epistaxis, please look at the age. Okay, please look at the age. Less than 10 years, nose picking. 10 to 20, that is angiofibroma. More than 20, that is hypertensive bleed from the nose. Okay, right? Then comes fourth question, which can come on your nasal epistaxis, is posterior epistaxis. Posterior epistaxis कहाँ पे होता है? That happens in Woodruff's plexus, right? Woodruff's plexus. It is a arterial bleed or venous bleed. See, these are the revision classes, so you should know something, or at least try to murmur in your head. Okay, थोड़ा सा सोचो, पेपर एक महीने बाद है ना. Venous. Which color bleed will be this? Bright red or coffee bean color? Coffee bean color. Okay, coffee bean color, right? Causes of posterior epistaxis, anyone? These are the hints in your exam to catch anterior epistaxis, that is normal nasal epistaxis, and posterior epistaxis. History of painkillers. Winter and daru. You have to catch this whenever you are going to get a question on posterior epistaxis. With what? Coffee bean color nasal bleed, right? Now, tell me, what is the management? Management? Anyone? First, क्या करेंगे हम? Nose pinching. This is called as what? That is Trotter's method. Remember, that is Trotter's method, not Trotter's triad. Trotter's triad is different. Okay, this is how we do it. We will tell the patient to pinch his nose and move the head towards his chest, yeah? So that can clot the arteries which are bleeding. Okay, if bleeding is not stopping by doing Trotter's method, what should we do next? And this is the catch in your exam. Though we don't do it usually, but exam we have to follow the guidelines, right? What is the next? Anyone? No one? We will do cautery with silver nitrate. Okay, cautery with silver nitrate. Okay, still bleeding is not stopping. Still bleeding is not stopping. What is the next line? That is called as nose packing. Nose packing. What we will do? We will pack the nose. How we will pack? We will put something inside the nose. That is called as nose packing. Okay, we will take a Mirosil bandage. This is called as Mirosil bandage. Okay, we will soak this bandage in the NS and then we will put it inside the patient's nose. Okay, now even after doing nose packing, patient bleeding is not stopping. Okay, one catch point which I want to tell you. Nose bleeding, nasal epistaxis with hypertension. With this treatment, what we have to do? We have to control his hypertension, right? If there is too much blood flow in the pipes, right? Can that pipe clot? Suppose कहीं पे पंप चल रहा है, उसका पाइप कहीं पे फटा हुआ है, पाइप जहां से फटा हुआ वहां से पानी तो आता रहेगा, है ना, until unless we block it or we switch off the motor, right? Over here we have to do both. We have to switch off the motor, that means decrease the hypertension, decrease the blood flow in the arteries, right? Plus pack that pipe जहाँ पे फटा है, right? Same we are going to do over here as well. Nose packing हो गई, still bleeding is not stopping. Next step, that is arterial ligation. Now tell me, which is the first artery that should be ligated? You would have thought this is the time pass, but now tell me which artery should be ligated first. Most common artery leading to epistaxis, that is spinopalatine artery, right? So we will ligate first artery kaun si? That is spinopalatine artery. Now still bleeding is not stopping. What do you think next? Now there are two branches of one common artery which supplies little area, that is spinopalatine artery and greater palatine artery. So we will directly block maxillary artery, right? We will directly block maxillary artery, correct? Now, still bleeding is not stopping. We have blocked this one. We have blocked this one. Now, how many arteries are remaining which can cause bleeding? That is this one, and this one, right? Or this one. So ये तो खत्म हो गया यहाँ पे, बचा क्या है ये सब. So instead of wasting our time, what we will block? We will block external carotid artery directly. Understood the sequence, right? We will directly block external carotid artery. Now the extreme question, still bleeding is not stopping. Then last one is ethmoidal artery. That is the branch of ophthalmic artery which give anterior ethmoidal artery and posterior ethmoidal artery. So we will directly block ethmoidal artery. Reason being, there is only one artery which is supplying to the lateral area. Okay, we will directly block ethmoidal artery. That's it. This is your recent question. Okay, tell me which is the view? You know it. This is called as water's view. Water's view. Now tell me which sinuses are not seen on water's view. Remember, this is, if you will get this in the option, you have to rule out this posterior ethmoidal sinus followed by sphenoid sinus. You will get confused because most of the time you know the answer is sphenoid sinus, but believe me, they will give you both in the option. The best answer will be posterior ethmoidal sinus. Okay, best answer is posterior ethmoidal sinus, right? Best for this view is best for which sinus? Yes, maxillary. Now tell me how to differentiate water's view from which view? That is Perez view. Perez view. Take a look again and take a look over here. What do you see? If you are seeing a straight line in the mouth, okay, if you are seeing straight line in the mouth, that is Perez view. Okay, straight line in the mouth. The reason being, see, we are going to see sphenoidal sinus in this view. Okay, if you know the shape of sphenoid bone, there is a straight line which goes down from the sphenoid bone. नीचे की तरफ से straight line है sphenoid bone पे. As soon as we open the mouth, we are going to see that straight line on the X-ray. Okay. So when you are going to see straight line, this is Perez view. If you are not able to appreciate straight line in the mouth, that is water's view. Okay, that is water's view. आया समझ? Question do come. Okay. So which sinus is seen in this? That is sphenoid sinus is seen. Okay, we will see sphenoid sinus as well. What is this? Caldwell view. Now, see why we see best sinus seen on Waters view is maxillary, because the view is like this, occipito-mandibular view. Now in Perez view, instead of going like this on X-ray beam, instead of going like this on the X-ray beam, what we are actually doing? We are going like this. So X-ray beam comes from here and goes like this. So which sinus should be highlighted on the X-ray? That is, reason being, we are going to tilt it. So beam will be straight like this. So frontal sinuses are best seen on which view? That is Caldwell view. Okay. Best for what? Take a look over here. Okay. Best for frontal sinus. Okay. Nasolacrimal duct. Recent question. What is the direction of duct? Anyone? That is downward, backward, and outward. Okay. Boys can read it. Duct ko dabao. When you will dabao your duct, then you will have fun. So mnemonic is dabao. Okay. Where does nasolacrimal duct open? In which meatus? And where we do dacrocystophranostomy. Both are different. There are two ways of learning. If you are smart enough, you would have seen it already. But problem है हम confuse हो जाते हैं sir. Yes, it opens in inferior meatus, right? It opens in inferior meatus. Now, my nasolacrimal duct is blocked, right? My nasolacrimal duct is blocked. I am going to put an artificial lacrimal duct, nasolacrimal duct. Which meatus is closest to inferior meatus? That is middle meatus, right? So natural opening is present in inferior meatus, which I cannot use it anymore. So I am going to put a artificial nasolacrimal duct where closest to the inferior meatus, that is middle meatus. लॉजिक लगाओ, मैजिक होगा. Why we are going to do in middle meatus? Understood? Reason being, पास में है उसके. चल, this is your recent question. Now come to next. What do you think? CSF autoria is due to trauma too. Now I want everyone to answer. This is called mind games. CSF autoria. CSF rhinorrhea. Now tell me, auto. Auto means what? Rhino. Rhino means nose. So you have answered wrong. Fracture of base of skull or fracture of cribriform plate is called as CSF rhinorrhea. CSF arteria means what? CSF is coming out of where? From the ear, right? So where does ear is located? It is located in the temporal bone. So there has been connection from brain to ear by damage of what? That is temporal bone fracture. Okay, this question has been repeated so many times. Reason? A simple plain English. A one word, change the answer. Okay, now you understood. Auto means ear, rhino means nose. Do not get confused. Now we come to this question. Continuous watery discharge from the nose after trauma. You know this by now. That is CSF rhinorrhea, right? Which sign we do see? First, take a look. This is CT cysternography. Fracture of base of skull. This is the base. This is the base. Now take a look over here. You can see continuous line which is going through this part. Now take a look over here. There is breakage. There is breakage, right? So whatever CSF is present in the brain is going to come down. Is going to come down. This is called as CSF rhinorrhea. Which sign we see? If we will take out that discharge which is coming out of the nose, we will see target sign. Target sign. This whitish part is CSF, okay, and this reddish part is blood, okay. This is called as target sign. And we will tell that patient to bend down. If he bend down like this, there will be continuous dribbling. There will be continuous dribbling. We have used this, or you would have seen in the cafe. Whenever we pour chai or coffee, what happens? From the teapot, टेढ़ा करने के बाद गिरता है नीचे. Same thing is going to happen with this patient. This is called as teapot sign. Okay, teapot sign. Now tell me, investigation of choice is, of course, city, cisternography. Okay, this is investigation of choice, right? But I can ask you question related to this fluid which is coming out. Okay, most specific indicator. That is beta 2 transferrin. Beta 2 transferrin. Normally in the CSF we do not have beta 2 transferrin. Okay, but as soon as after having trauma, we will see beta 2 transferrin. Okay, it will be positive. Sorry, my mistake. In the CSF we have beta 2 transferrin. Okay, the discharge which come out of the nose, it do not contain beta 2 transferrin normally, but as soon as CSF is leaked in his nose, we will see beta 2 transferrin. Okay, a businessman from the Delhi, went to some village. Now he is having discharge from the nose. Okay, now he is having discharge from the nose. What is the cause? फिर से रिपीट करता हूँ. दिल्ली का एक बिजनेसमैन है. He went to some village. Now he is having, क्या हो रहा है उसके नाक से पानी आ रहा है कंटिन्यूअसली. नोज डिस्चार्ज क्या होगा? रिमेंबर, दिस इज एलर्जिक राइनोसाइनोसाइटिस. Why I said a businessman? Okay, they are not exposed to the allergen on everyday basis, right? So they are going to have discharge from the nose. क्या हिंट होंगे पेपर में? हाई सोशियो इकोनॉमिकल, है ना? Most common cause of allergic rhinosinusitis. These are easy topic, but you can get confused when you are going to get a question. I can make two questions from a same line. A businessman woman going to a village. Okay, a businessman woman going to a village, now having nasal discharge. आंसर क्या है? एलर्जिक rhinosinusitis, right? Most common cause is dust. Okay, confirmatory test for allergic rhinosinusitis, you would have studied this in microbiology. Which test we do to check allergen? Immunology. Which test we do to check allergen? That is called as skin prick test. We will put different types of allergen on the back, right? On the back of the patient. So confirmatory test क्या होंगे allergen check करने के लिए? Same. We will do skin prick test, right? Now comes gold standard. What do you think? In this, we are going to provocate the nose by putting different kind of allergen inside the nose. नाक के अंदर ही हम allergens जैसे स्किन पे डाल रहे हैं स्किन prick test में. Now we are going to put allergens directly inside the nose. That is called as provocate the nose. Provocation test. Directly हम किसको provocate कर रहे हैं? We are going to provocate the nose. That is called as provocation test. Treatment क्या होंगे? Allergic reaction. What do we give? We give antihistamine. Right? Next. What I said over here? Rich female, right? Now comes cry baby female. Cry baby, why I said? इसी को हम बोलते हैं right? Who used to cry on a small topics, right? Right? On small topic. So emotional female having nasal discharge. So that is called as vasomotor rhinosinusitis. What do we call it? Vasomotor rhinosinusitis. What happens over here? The median nerve get parasympathetic stimulation of which nerve? Median nerve. Hint क्या है पेपर में? Emotional female. Now, which nerve is involved over here? Median nerve, right? It is not because of some kind of allergens. So, what should be the treatment? First, tell that woman to stop being emotional, right? But of course, she will not. So, what we can do? Either give anticholinergics, correct? But the baby will not stop crying. So ultimately, what we need to do? We have to cut what? Median nerve. So this patient will not have what? Continuous nasal discharge. Right? Two question. History can start similarly, but you need to remember this. And this. Okay. Fungal rhinosinusitis. Okay, tell me most common fungus causing rhinosinusitis. Anyone? Aspergilloma is invasive or non-invasive? Yes, it is non-invasive. So it will take the shape of a organ or the bone. ठीक है, जितना उसका size है, it can grow till that only. Okay, it will not cross. It will not cross. Fungal ball is due to which aspergillosis? Aspergillus what? Fumigatus. Aspergillus fumigatus. You haven't answered the question. Most common cause of common fungal infection causing rhinosinusitis. Answer lies in this topic. Okay. Causes of allergic fungal sinusitis. Anyone? First one is Aspergillus fumigatus. Second, bipolaris. Third one is curvularia. A, B, C. Most common cause of fungal rhinosinusitis. Easiest question. I know you know the answer, but still you are getting confused between Aspergillus and mucormycosis. But answer is something else. It is bipolaris. It is bipolaris. Okay. Okay. Remember, CT scan of fungal infection can be of different types. Same image can be seen in mucormycosis. Okay. So to diagnose a fungal infection, CT scan, for example, is not an investigation of choice. To diagnose the fungus, what we need to do? The best method is fungal culture, right? But it take 1 month to grow fungus. You would have studied this in microbiology, right? Now, what is the criteria to diagnose allergic fungal sinusitis? Anyone? The name? That was the question. Straightforward question which has been asked. That is no one bent and आगे Kahan criteria. Bent and Kahan criteria. In that we have major and minor. Now you can get a question like this. Okay, all of the following are major criteria except. Okay, as a human being, what you will do? You will look at the what? The bigger name, right? Secondly, हाँ ये तो बड़ा लग रहा है तो this one is major criteria. Take a look over here. It is minor criteria. Fungal culture is a minor criteria. KOH mount we use as a screening test to diagnose fungal infection, right? Okay, we can get result within the hours. So KOH mount or fungal smear is a major criteria, but the culture stand where? Okay. Eosinophilic mucosa and eosinophilia. These are different. Mucus contain what? Eosinophils. Okay, eosinophilia is seen on blood investigation, right? So both are different. Please remember this. What is the answer? Answer is mucormycosis. Mucormycosis, right? Drug of choice? Anyone? Rhinocerebral mucormycosis. Drug of choice is amphotericin B. Amphotericin B, right? But it is not in the option. Then posaconazole. Okay, posaconazole is the second best answer. Now, what you will see on the KOH mount? What you will see on the KOH mount? Basic class of microbiology, page 1 of fungal infections. पहले पेज पे पढ़ाया जाता है माइक्रोबायोलॉजी में. There are two types of fungus. One is septate and aseptate. Septate means separated. Aseptate means not separated. Now take a look over here. Everything is in the continuation. So this is not separate branching. इसी को हम बोलते हैं नॉन ब्रांचिंग और aseptate. hyphae. Non-branching fungus that we will see on the KOH mount. Okay. Drug of choice is amphotericin B. Surgery करते इसमें. Okay. We do surgery that is called as debridement. What we will do? We will remove this infected part. Okay. खोद खोद के सब निकाल के फेंक देंगे. And what will be left? Like this for the rest of the life. Okay. Rest of the life, patient will have face like this. Okay. We are very fortunate, some of us, that we didn't had mucormycosis. Otherwise, we would have had such deformities. Emotional female vasomotor rhinosinusitis. Now, young female from with foul smell from the nose. Young female with foul smell from the nose. What do you think? These are the hint. ENT 10 पेज में नहीं, एक पेज में खत्म होता है. You should know it. Hint सही है. Young female with foul smell from nose. Emotional female vasomotor rhinosinusitis. Young female with bad smell from the nose. Atrophic rhinitis or atrophic oceana. Caused by whom? Causes. Klebsiella oziana, right? Decrease in estrogen. And decrease in which vitamin? Decrease in which vitamin? If it is not in the option, the answer is vitamin A, right? Vitamin A. And the nose is called as roomy nose. Roomy nose. ठीक है? What do we do for the treatment? We will wash this nose with what? Young female, right? She love this. That is sodium bicarbonate. Sodium bicarbonate. Third one, sodium chloride. Okay. They will ask all except present in nasal alkaline nasal douche except. The answer is this one. Chemistry in solution content. How many components? What do you think? You love to go to this place for a coffee. Chloramphenicol, chloromycetin. D stand for what? Vitamin D. And last one is estradiol. Reason young female, right? Estradiol. Again, I'm repeating. High socioeconomical female, allergic rhinosinusitis. Emotional female, vasomotor rhinosinusitis. Young female with foul smell from the nose. Answer is atrophic rhinitis. Atrophy of rhinus, that means nose. Okay. See, they will not ask much about the polyps. Okay. The normal polyps which we see, they can ask one question. Samster triad. Tell me the triad. You would have seen a movie where father and the son is acting. The name is Pa. Polyp, that is nasal polyp or sinusitis. A stand for asthma. Now tell me aspirin sensitivity or aspirin insensitivity happens in Samster triad. Very good question. Intolerance means what? एस्पिरिन एलर्जी, उसका मतलब होता है एस्पिरिन insensitivity, right? Now a simple question with a simple hint. Polyp, polyp with nasal bleeding. Answer. That is the hint only. Polyp with nasal bleeding. Polyp with bleeding. Polyp with bleeding. Whenever you are getting question with just this much hint, remember answer is inverted papilloma. Finished. Polyp with nasal bleeding. Answer will be inverted papilloma. What we had? Young female with foul smell, right? But now I am now going to talk about foul smell with epistaxis. In atrophic rhinitis, we do not had bleeding from the nose, but over here, foul smell with epistaxis is seen in rhinolith. What is the meaning of rhinolith? Anyone? उसका मतलब है old, calcified body. Old calcified body. Okay, समझ आया? Foul smell, young female, answer is atrophic rhinitis. Foul smell with bleeding, answer will be rhinolith. Okay, treatment क्या करेंगे हम इसमें? Take a look over here. This whitish part is calcification around an object which is present in the nose. Okay, calcification हो गया उसके अंदर, right? It became like a stone. So that's why it is called as rhino means nose, lith means stone, right? So answer is removal of that calcified part under general anesthesia. We will remove that. Rhinophyma or potato nose. What happens over here? There will be hypertrophy of what? Sebaceous gland, right? Hypertrophy of sebaceous gland, right? Caused by acne rosacea. Acne rosacea. Okay. A patient from UP and Bihar now coming with tightening or crust formation in the nose. कौन करवाता है? tightening of nose or crust formation in nose. Patient is from UP and Bihar. Answer will be woody nose. Okay, caused by Klebsiella rhinoscleromatis. Common in UP, right? UP and Rajasthan. ठीक है? What do we see on biopsy? Mikulicz cell and Russell body. What we are going to see? Mikulicz cell and Russell body. Okay, treatment. Laser excision. Treatment is laser excision plus what? We are going to give a drug that is streptomycin or rifampicin. Okay, streptomycin or rifampicin. A red mass coming out of the nose. Okay, patient was from Tamil Nadu. Rhinosporidiosis. Okay, इसी को हम बोलते हैं, this is called as strawberry and this is called as mulberry. Okay, polyp plus epistaxis. Where do we see? We see it in rhinosporidiosis. ठीक है, caused by Rhinosporidium severi. Caused by Rhinosporidium severi. कहाँ मिलता है? I have just said Tamil Nadu. Okay, what we are going to see on biopsy? Increased thickened sporangia. Increased thickened sporangia. Okay, that is the hint. Simple line which you will miss. What is going to happen over here? Thickness बढ़ेंगी sporangia की. Treatment CO2 laser excision. Okay, plus Dapsone is the drug of choice. Dapsone is the drug of choice. Patient of nasal bone fracture. What is the treatment? Your recent question. Treatment Treatment is close reduction plus internal fixation. How we will do? Is done by which forceps? Take a look over here. This forceps also can be asked. As forceps will have long metal. Wash forceps is more curved. Okay, वॉशमैन फोर्सेप्स इज टेढ़ी है और एक ऐसी सीधी है. एश फोर्सेप्स कैसी दिखने में? इट विल बी स्ट्रेट. वॉशमैन फोर्सेप्स कैसी है? इट इज मोर कर्व्ड. ये लंबा है ज्यादा, ये कर्व्ड है. क्लोज रिडक्शन इज डन बाय एश फोर्सेप्स और वॉल्शमैन फोर्सेप्स. ठीक है. नाउ क्वेश्चन विल बी ट्रिक्ड. nasal bone fracture with edema. Nasal bone fracture with edema. What do you think? We will wait for 7 days. If edema present. Okay, we will wait for 7 days. Yes, 1 week. So that edema can subside and we will do close reduction again, right? Then we come maxillofacial fracture. Okay, maxillofacial fracture or fracture of maxilla, right? First one is transverse. Leaford one is transverse fracture. Transverse का मतलब क्या हुआ? The maxilla is dislocated transversely, right? Cut कैसा हुआ? Transverse. So Leaford one is T. ठीक है. Pyramidal. Pyramid कैसे दिखता है? Like this, right? So same. Leaford 2 fracture will be like pyramid, right? Pyramid. You can easily remember by the mnemonic TPC. Tamil Nadu Premier. Sorry, I just missed the mnemonic. Mnemonic is TPC. Okay, chalo. TPC is the mnemonic. Then comes nasal septum fracture. One is horizontal, and second one is vertical. Horizontal fracture of nasal septum is called as what? Name is Jar-Jave, right? Jar-Jave fracture. And second one is Chevrolet. How to remember? Remember one, second one will be easy. V goes with V. ठीक है. V goes with V. That is Chevrolet. V है vertical, उसका opposite other name. Patient with tennis ball hit on the orbit or punch on the orbit. Fracture name is orbital fracture, right? Take a look over here and take a look over here. This line is continue, but over here it is disrupted, right? This is fracture of orbital floor, है ना? orbital floor fracture, right? This is on the X-ray, right? Waters blue, and this is on the CT scan. On the CT scan, what we are going to see? यहाँ पे देखो, this line is continue. Over here, it is broken. So the content from the orbit is going to come in the maxillary sinus. So this is called as actually tear drop sign. कहाँ मिलेगा हमें? Fracture of orbital floor. ठीक है? We will stop over here. Nose is finished. I will take throat tomorrow. Okay, throat tomorrow. That will be okay. We had one half hour class. Your nose is almost finished. Okay. So we will meet tomorrow. That will be okay. Chalo. Good night to all. Thank you. Thank you.